balance and nerve transmission. Potassium, or K, is crucial for cardiac rhythm and muscle contraction. Calcium, or Ca superscript 2, supports bone strength, clotting, and neuromuscular activity. Magnesium is an enzyme activator and aids nerve conduction. Chloride and bicarbonate help maintain acid-base balance and osmotic stability. Each electrolyte must remain within a narrow range. When levels deviate, the effects can be significant, especially on heart, brain, and muscles. Regulation of fluid and electrolyte balance. Our body uses several systems to maintain balance. Let's look at the main ones. The thirst mechanism, controlled by the hypothalamus, responds to increased blood osmolality or decreased volume by stimulating water intake. Hormonal regulation plays a major role. OADH, or antidiuretic hormone, promotes water reabsorption in the kidneys. O-aldosterone increases sodium retention and potassium diet, and medication compliance. Summary. In summary, fluid, electrolyte, and acid-base balance are fundamental to homeostasis. The body relies on buffer systems, respiratory regulation, and renal compensation to maintain a stable pH. Disorders of these systems, whether respiratory or metabolic, require accurate diagnosis, interpretation, and timely treatment. A strong grasp of these concepts is essential for every healthcare professional. That brings us to the end of today's lecture on fluid, electrolyte, and acid-base balance. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.